Hey guys, I'm back for a minute. I've been gone for a couple of days doing taxes, the bane of my existence. But I thought I would hop on for a little bit because after this, then I'm going to be gone for another couple of days to get ready for a speaking engagement. So thought I would hop on and answer any questions that anybody has. So pop those in for me and I'll see if I can keep up or if I can track them better than I did last time. I know I missed some questions. The whole thing was new to me. Thank you all for your gifts, all the different gifts that you guys sent. I'm still learning what all of that means, but I appreciate you. I appreciate every one of you for chiming in. I would love to see what kind of questions you guys have tonight. Thank you guys for joining. I see some people hopping on with me, so thank you. And I'm just answering general questions. So last time I had like frequently asked questions about my practice and myself. So this time I want to just answer whatever questions you guys have without getting into like therapy or whatever, just trying to do some basic psychoeducation. So thank you all for hopping on. I appreciate it. Any questions that you guys have about anything that I treat or my history or my book, you can see right there, several copies of my book on marriage. It's actually a great book for relationships in general, kind of a relationship primer, because it talks about all of the things that are crucial in marriage, 16 different elements. It talks about dealing with challenging partners. It talks about forgiveness. It talks about why marriages don't work. Lots of different information like that. It's also good for premarital counseling. So that's an option as well. So you can find that on Amazon. It's right up there. You can see it. It's called Fix Your Freaking Marriage, a practical guide to just start somewhere. So the idea is that I wanted people to understand, like, I'm coming in hot here. There's not going to be any mollycoddling or, touchy-feely. Like, we're going to really get to it and we're going to talk about real things and real issues. So if you guys have questions about marriage, pop those in the comments. If you guys have any questions about my practice, anything that you want to talk about, let's see what kind of questions you guys have. Thank you guys for joining. I appreciate you. Okay, Angel or Angel, I have a question. Go for it. Hurtful comments. So this is a different question. Hurtful comments. I think it's the thing is you have to be very careful about setting your boundaries. So you don't deserve to be mistreated. You can set boundaries when those kinds of things happen and walk away from the situation. You can, as it's going on, you can say, you know what, call a truce. I have people do what I call throw a code word. So if there's a code word that you and your partner can agree on ahead of time, then when there is stuff going on that the intensity is mounting and we can see this with flashing red lights, this is not going to go well, then you can throw the code word and you both know to separate and go to your respective corners and then reconvene later. It's one of those things where you want the code word to be funny. You want it to be something that catches attention. So I've had people use code words like chimichanga, periwinkle, watermelon, you name it. They're all different kinds of code words that people have used. So that's one option. And then both of you to get therapy to navigate that better. And that gives if you're doing an evaluation with a therapist, that's going to give them more context, more history, more patterns. They can talk with you about how to do that. There is a chapters in my book about dealing with challenging partners. So that might be a good read. Again, it's called Fix Your Freaking Marriage, but it's a good relationship book. So I'm sorry, I'm still not keeping up. Safe way to bring it up. So once the code word is thrown, Michael, the understanding should be that we're going to come back to it later. So you can go back to your partner later after you guys have, eaten, watched a movie, took a nap, slept for the night, whatever. Whenever you want to come back to it, just make sure you come back to it. Then you can just say, hey, are you ready to talk about what happened the other day or the other hour or, just a little bit ago or whatever. Thank you, Tessa. I do like the code word. I write about that a lot in my book because it just really helps people kind of just break off the intensity. You can see it's not going well, so you might as well step away. Help my girlfriend who has BPD on the day of an anniversary of a death. Oliver, that's really challenging. I think the best thing you can do is just be supportive, be present, be helpful. And one of my favorite questions to ask is just, how can I help? So what can I do for you today? Is there anything special that you would like for this day? Or if it's coming up, you know, next Tuesday or whatever, is there anything that you'd like for us to do that day? Is there anything special? And just basically, how can I help? Let them tell you how they want you to help. How can I introduce my doctor to think I have BPD? So I get this question a lot. I think the best thing to do if you already have a provider is to ask them to go through the criteria for BPD with you line by line. So they can pull out the DSM and they can walk through the different diagnostic criteria, the 9 criteria, and they can take a look and see if you meet the symptoms. 5 of 9 is what's required for a diagnosis. But as they go through each criterion, you can give them examples of what it is that you think goes on for you that applies to that and how that fits. So that's probably the best way. If they refuse to listen to you, or they say, I don't believe in that diagnosis, or I don't want to give you that, or whatever, then I would say, you know, it's important at that point to just keep searching for a therapist with whom you connect and someone who is willing to listen to you, because ultimately you know yourself better than anyone else. That's the bottom line of it. So keep searching until you find a connection with a therapist. Other questions that you guys have? Michael, you're welcome. CPTSD, complex post-traumatic stress disorder, and BPD. Okay, so PTSD, there's no actual diagnosis called CPTSD. It just means that generally, very broadly described, there's more than one trauma. So PTSD can be brought on by one traumatic event. CPTSD is the name that people are throwing around to indicate that there have been multiple traumas. So when I talk about PTSD, I just say PTSD. So that's the same thing here that I'm talking about. So PTSD and BPD do have a lot of overlap, but they have some differences too. I'm actually working on some material on this, and it's taking a while because there's a lot of nuances and so forth. But basically, PTSD and BPD can both be caused by trauma. Most people who have BPD also have PTSD. So if you guys saw the video series I did on the 4 causes of BPD, trauma is the most common one. And so the trauma itself could cause PTSD, which is also a part of BPD. So there are some differences. As I said, I'm working on content on that. I want to make sure I have it really distinct so that it's very clear. But trauma can cause both of them. And with PTSD, with BPD, we're looking for more of the emotional volatility, the lability, the abandonment issues, those kinds of things. Whereas PTSD is an anxiety disorder by nature, so there's a lot more related to like hypervigilance and anxiety. Not that anxiety and hypervigilance can't be part of BPD, but there may be some overlap. When a person has both of those diagnoses, it's kind of difficult. But they need to meet symptom criteria for each diagnosis distinctly. So there's some overlap and some differences, and I'm going to work on more information on that. But that's the gist of it, just off the cuff. Really, Ink Rock? Seriously? Come on, grow up. Do you think ADHD can be confused with BPD? A lot. I'm getting this question a lot, that people think that that's the case. I personally don't. It's the criteria for ADHD and the criteria for BPD are very different. They're more different than they are similar. There's some overlap in terms of emotional issues that could fall under impulsivity in either disorder for someone who has ADHD, impulsive, hyperactive impulsive type. So sometimes it is confused, but the criteria are very distinct. So if you're not sure, I would get both of the criteria and take a look at those and really kind of walk through each of those and see what you think. A lot of people have taken the ADHD criteria and extrapolated, and they talk about it in ways that they're just kind of making generalizations or other things from, and the technical criteria don't actually fit all the time. Opal just hopped up on my lap. You guys have seen her before, but here she is. She just decided to hop on my lap for some reason. Linda Martin and Lucifer, I've heard that. Sorry, I'm trying to keep up. Possible that my therapist would hide a narcissism diagnosis from me. Yeah, a lot of therapists are afraid to give the personality disorder diagnoses because they think it's a death sentence. It absolutely is not. They are treatable. They're not technically curable, so we can't say that, but they are highly treatable. You can ask them point blank. That's what I would do. Person with BPD in a poly relationship. Oliver, I don't recommend it. I'm just gonna be real honest with you. I think it's hard enough for someone with BPD to navigate a one-on-one relationship. And I think poly relationships bring a lot of issues with them in general. So I think that just adds insult to injury in terms of emotional management. Just being real frank with you. A way to know you are splitting in real time. Great question. So that's something you're going to have to learn. You'll have to go through therapy and learn what that's like, because I think you first have to know what splitting is. So a lot of people think that it looks a certain way, but it can look a number of different ways. So once you realize that you have that tendency, then what you can do is become mindful of certain emotional responses that are kind of welling up within you, for lack of a better word, and then you'll know that splitting is about to come, and that's when you can step away and go re-regulate yourself and then come back to the situation, or just step away from that person and don't return if they're not someone who's significant to you. DBT therapy, yes. Okay, sorry guys, a lot of them are popping up at once, so let me try to keep up here. I'm going to come back to DBT, BPD, DID, and PTSD, usual trio diagnosis. I personally have never seen a case of DID, so I'm not the person to ask about that. BPD and PTSD, very often comorbid. DID can co-occur. I think that sometimes gets diagnosed when the splitting and the emotional lability, the variability of emotions is very drastic in BPD, where what we're seeing is just different aspects or dimensions of that personality. Sometimes if it's really drastic, it can look like a totally different personality. Okay, all right. Ever psychoanalyze women who watch and listen to true crime? I'm sure that data is out there, Dingleberry299, but I'm not sure. I enjoy a good true crime now and then. Yeah, living with them is probably going to be challenging, Oliver. Okay, let me go back to DBT before I lose sight of Michael's question. So DBT has 4 modules. Stands for Dialectical Behavior Therapy, invented by Marsha Linehan. She was hospitalized for about 2 years in an institution, didn't like what they were doing. She has a diagnosis of BPD. She's come out very publicly about that. She has scars up and down both of her arms. She came up with it because she didn't like what was happening at the inpatient unit that she lived in for a couple years, and so she came up with her own way. 4 modules. There's mindfulness, interpersonal effectiveness, distress tolerance, and, oh my gosh, I just blocked. Mindfulness, distress tolerance. Oh, interpersonal effectiveness. Oh my gosh, you guys, I just blocked it. I lost it. Somebody knows it, I'm sure. Emotional regulation. That's it. Okay. Woo. Sorry. It's time for dinner. So you go through the 4 modules. Mindfulness is first and foremost. So it's basically learning how to get in touch with what's going on with you. It doesn't mean you have to sit there and meditate and do this whole Zen thing. No, mindfulness is just about being aware of your emotions and what's happening for you so that you can then respond. 2 of the modules, the theory is built on a continuum of acceptance versus change. 2 of the models for accepting the things you can't are for accepting the things you can't change. 2 of the models are for changing the things you can. And so it's really a very in-depth treatment. It shouldn't be a specialized treatment. A lot of people are talking about that. Any therapist or psychologist who's trained in it, I just do it as part of my regular therapy. I don't charge a special fee or have a special program for it. It's just part of regular individual therapy. So basically you're learning to control your emotions, you're learning how to be effective in your communication, and then you're learning what to do when you start to really get frustrated, get overwhelmed, disappointed, some people say freaked out, or have an episode. Then it teaches you how to regulate that. So that is like the complete Reader's Digest version. Okay, splitting on me, I don't know how to keep reaching out and I'm assuming I put myself out there. If a friend has BPD and is splitting on you, you get to have boundaries. So you can bring that to their attention and you can ask them just what's going on. Help me understand. That's one of my favorite phrases. Help me understand what's going on for you, because we were doing just fine and then something happened and I'm missing the piece in here. I've seen people do it in my office in session where we're trucking along, doing well. They're, reviewing the events of their week that they need help on, whatever it is. And then all of a sudden I say something and you can see it wash over them, that they suddenly feel totally differently toward me and toward what's going on in the session. And so that's a time when you say, okay, pause, hold it. Let's figure out what's going on. Here's what was happening. And now there's this. Can you help me understand what is going on for you? I really want to understand. Come from a place of understanding and concern. Okay. Live with them and seems like a mistake, but now feel stuck. Yeah, I would do what I can to get a different living arrangement, or else put up really solid boundaries, or maybe end that relationship within the living arrangement. That's tough when you're all in the same house. Okay, told me about BPD. I suspect they may be keeping narcissism from me. So there's a lot of overlap in the cluster B. I did video on personality clusters, and there are 3 of them across 10 disorders, and there's a lot of overlap. So BPD and NPD can overlap with histrionic and antisocial personalities. And so I would just ask them point blank, like I said, hey, I wonder about this. You can get the criteria for narcissistic PD, and you can go through them and say, look, here are the things that I experience, that I'm endorsing, that I think might qualify for that as well. So can we talk about that? Just tell me the truth, tell them, just tell me the truth. I can handle it. I want to get the right treatment plan. It's going to be the most helpful. So can we just really talk about this honestly? I think people are scared. Sometimes it's therapists, sometimes it's patients, sometimes it's both. Do you see clients? Yes, I don't know where that went. It just disappeared. Yes, I do. If you are interested, I can practice in most states in the United States. There are some holdouts. Message me and we'll start a conversation about that, and I'll see if I can help. You're welcome, Tessa. My pleasure. Thanks, Ellery. What exercises would that help? I guess what exercises would help deal with BPD? There are a lot. You can get a DBT workbook. If you go on drbellingrodt.com, my website, you can go to the resources tab, and there's a whole section on BPD. One of my favorite books on BPD, I mentioned this in the last live, is actually Get Me Out of Here by Rachel Ryland. And that was recommended by a patient with BPD, and it is such a great depiction of the disorder. So it's helpful for people with BPD to read to feel validated. It's also helpful for people around them to read to really understand what's going on. But I would get a workbook, Athena, and I would really look at some of the exercises in there. Anything by Linehan is good. There are lots of other workbooks, but check out the resources tab. You're welcome, Michael. My pleasure. Okay. Do you think BPD could be stopping me from starting college? Absolutely. That fear of failure, that fear of, it all falls in with like fear of rejection, fear of abandonment. It's all fear of failure. It's all feeling like you aren't good enough to be, get, do, achieve, accomplish whatever it is that you want. And so I think there's a lot of fear that's associated with that. But you definitely can get some treatment and get over that hurdle. Plus there's procrastination and anxiety and perfectionism and a number of other things that could be contributing as well. Oliver, I would just work on some really solid boundaries in that poly relationship then, man. Michael, is it helpful to have a loving relationship while they're seeking treatment for BPD? So I tell people that it's not impossible. If someone comes to me with BPD and they're not already dating, I will encourage them to stay out of the dating world just while we get a better handle on things and get some coping skills for emotional distress and tolerating those kinds of things. It is possible to still have it, but it's probably best if the partner is involved in the therapy as well, if they are willing. Walking on eggshells. Yes, Michael, that's on my resources. Under the resources tab on my website. Okay, Oliver, that sounds like a plan. That sounds like a great start. Does betrayal trauma trigger BPD? I think it has, but I don't know how extreme it could be. Yeah, I mean, any sort of trauma can trigger a reaction with emotional intensity in someone with BPD. Nikki, if I'm not answering your question, please say more about that. Oh, shoot. Okay. Sorry, guys. Still learning. But my camera's not shaking as much this time, so I feel like I've made an improvement. Jurassic, that is awesome. Very encouraging to A&W. That's fantastic. Strong, solid, dependable relationship. If it's a great relationship that's very solid and dependable, reliable, trust is a part of that, all of that, then you can work through it, definitely. Like I said, you may want some individual therapy for either of you, maybe some marital therapy, maybe both, or relationship therapy, even if you're not married. As I mentioned, my book up there, Fix Your Freaking Marriage, is a relationship primer. It's great for any kind of relationship. It's also good for premarital counseling if you're thinking about a relationship or thinking about getting married. Has chapters for dealing with difficult reactions in your partner. Talks about forgiveness, talks about reasons marriages don't work, talks about 16 elements for a successful relationship. Let me plug that again. It's called Fix Your Freaking Marriage. You can find it on Amazon. Yeah, A&W, I would get a therapist to kind of come alongside you and kind of coach you through that. Your parents want what's best for you, I'm sure. I don't know them, but I assume they have good intentions. So it's probably just someone kind of guiding you through that process. You're welcome, Oliver. Okay. Limerence is a newer concept to me. I mean, the concept's not new, but the word is newer to me. It's actually a really old word, but it basically speaks to, like, from what I understand, it speaks to relationship, how you look at someone in a relationship. So what I read about it is that it can be related to a number of different things. It can be related to, like, lust. It can be related to just a lot of a misperception about a relationship. So Marissa, if you want to say a little bit more about that, maybe I can answer your question better, because it kind of has several different elements to the definition from what I understand. All for going to therapy with her. I hate seeing this in her. Absolutely. That's awesome that you're willing to do that. Night terrors. Interesting question. So yeah, very often we see them in children. And there's honestly not a lot of information. We still to this day don't know a lot about where they come from. People believe it's a neurological issue. Some people believe it's an anxiety disorder gone awry. You name it. All different kinds of explanations for that. That's a specialty, so I would certainly see, like, a sleep psychologist for some help with that specifically. Yeah, Oliver, it's a great book, I must say. 76,000 words, man. There's bound to be something in there that you find helpful. I have bipolar, but it seems like BPD explains my experiences and reactions to everything more. Yeah, bipolar disorder is often diagnosed when actually BPD is at work. I've done a lot of videos about the two, so you can go back and look at those, Nikki, if you haven't seen them already. But bipolar is, you're looking for more extended periods of time in a certain sort of episode. So for hypomania, it's 4 days. For mania, it's 5 days. Those are the minimums. Episodes, manic episodes, depressive episodes can last days, weeks, many, many months. It varies. But with borderline personality disorder, we're looking for that variability within the day, within an hour, sometimes within minutes or even seconds. I've seen people switch. Like I said, in my office, I've seen that, where people, you can just see this sort of look wash over them, where they have just suddenly changed how they're feeling and thinking in that moment. So you're looking for that very rapid fire sort of changing. You're also looking for maybe some anger. Some people with bipolar disorder have the angry, sort of agitated mania, so you might see it there too, but it's bipolar, from what we know, is more chemically triggered, whereas BPD is more situationally triggered, and it's brought on by one of those 4 causes that I mentioned, primarily trauma. Okay. Sorry, like obsessed. Like they don't feel the same, but they don't know how I feel. Marissa, it's up to you. If you want to tell them, I don't know the context of the relationship, so I would certainly need more to make solid recommendations. But I think you can, if you know that you have that tendency to go all in and get obsessed that way, like you're describing, then maybe slow play it and just kind of take it easy. If it's someone that you want to, that you already know, then you can just kind of slow play the relationship, keep physical intimacy, sexual intimacy out of it, get to know each other in other ways first. That's a whole discussion unto itself. That goes under my dating, me acting like your mom, when I talk about dating. So you can tell them how you feel. If you feel like you can do that in a way that isn't too intense, that you are afraid you might push them away. So you can find a way to tell them, or spend time with them, or just kind of sit on it and just kind of see how you feel and see if you still feel this way in a couple of weeks. Again, I don't know the context, so bear with me, but those are just off the cuff. Initially misdiagnosed with bipolar, first psych didn't really listen. Y'all, people are so reluctant to diagnose BPD. I don't understand it, but it's my specialty and I love my patients with BPD. So I'm an anomaly, I realize. A lot of people don't want to diagnose it because of ignorance or stigma. So ignorance, they don't know what they're looking at. They think, oh, your mood is up and down, you must be bipolar. It's a very overused, overdiagnosed disorder in this day and age. The other one is stigma. People are afraid that if the therapists, most often providers, psychologists, whatever, psychiatrists, are afraid that if they say, hey, you have a personality disorder, the person is going to perceive it as some sort of death sentence. They'll never get better. Life is over, la, la, la. It's all BS, okay? But a lot of therapists, the other thing is they're ignorant about how to handle it. So if I give you this diagnosis, I don't really know what to offer you. So then I would have to refer you, and maybe they're afraid to do that. Maybe they think you're going to be offended. I don't know. There's so much reluctance about diagnosing BPD. And I've done videos about that too. You guys can go back and look at those. That's okay, Oliver. It's on Amazon and barnesandnoble.com. My marriage book, my relationship book. It's called Fix Your Freaking Marriage. It's Amazon or barnesandnoble.com, bud. Thank you. Let's see. Can't really tell if it's my emotions or mood swings. Well, they're one and the same, Nikki. Again, I need more information, but emotions. So what happens is a thought comes in. Again, y'all have heard me say BPD is an information processing disorder. Yes, according to the DSM, it is a personality disorder, but it's really an information processing disorder. So information comes in, and if I have BPD, I'm looking at it through that filter. I'm looking at it through the lens of my trauma or my genetics or whatever it is. And then I'm going to take those thoughts, that perception turns into thoughts, the thoughts turn into feelings, and then the feelings result in behavior. So if it's internalized behavior or externalized behavior, whatever that looks like. But it's thoughts, feelings, behavior. So if your emotions, if the thoughts trigger some emotionality and the emotions get really intense, that will look like a mood swing. So hopefully that helps, Nikki. If not, say something else for me, girl. When someone is splitting or triggered, should you give them space or should you try to talk to them? It depends. Ask them what they want. I would say if it's really intense and they're yelling or cursing or throwing things, get the hell out of there. Absolutely, you don't deserve that. Step away, tell them you're leaving, come back to it later, bring it up like we talked about a little bit ago. If they are willing to talk, you can try. But if someone is in the midst of being triggered, you have to be very careful. When I've seen people split in my office, now I've been doing this for a long time, so I'm pretty skilled at it, but when I see people split in my office, I say, okay, hold the phone. Something just changed for you. Tell me what's going on, okay? So you can say something to that effect, like I was talking about with like the best friend splitting, like, hey, we were just having a good time, or this was going on, and then all of a sudden you won't return my texts, or you want to go in the other room, or you're yelling at me, or you're upset and I don't understand. Please help me understand. That's one of my favorite phrases, especially for BPD. Help me understand. Don't act like you understand it. Seek to understand it. Who says, how do you think I feel after you explain something that hurt? Okay, well, it's a fair question. Let me get back to that. It just jumped. How do you think I feel? Well, again, Oliver, depends on context. But I would probably say, well, I can imagine how you might feel, but I'd like to hear from you how you feel about what I just said. Can we have a discussion about this? I don't want to assume. So I would put it back on them, honestly, to make sure that you understand. Big Randy, nice try. Go away. Examples of doing the work outside of therapy. So you can go on the resources tab on my website and look under the section for borderline personality disorder. There are lots of books there. If you're talking about BPD, Irene, I'm sorry if you're not. But the resources tab has resources for all different kinds of diagnoses. But basically it's, reading, getting a workbook, practicing skills, going to a support group, really reading and self-help. I think that's what comes to mind initially. Tristan, thank you for policing. Facilitate getting my husband diagnosed. Well, he has to be willing. And then I would find a licensed clinical psychologist if we're talking about personality disorder. We tend to be more versed in personality disorder. Therapists, counselors, social workers, they understand personality disorder and they're aware of it, but most often they don't feel versed or adept in dealing with it. There are exceptions, so don't come at me if you are one or if you know one. I know you exist. My experience doing this for over 20 years, my LPC, social work, therapist colleagues refer their personality disorders to me because psychologists have more training on what used to be called abnormal psychology. I think it's still called that. It needs a different name, but that's the reference. So I would get a clinical interview, an intake evaluation with a licensed clinical psychologist if your husband is looking like there may be a diagnosis going on. Impulsive emotions are overwhelming. Okay. You're welcome, Irene. My pleasure. Talkspace can be good. I've not personally used it or been a therapist on there, but I know a lot of people are really benefiting from these virtual type modalities, whether it's texting or phone calls or video sessions. I mean, I do exclusively virtual now. So I'm sure there are some good therapists on Talkspace. I just can't say from personal experience if I've met any or know of any. Okay. Okay. Nikki, you're welcome. Thanks so much, Irene. Okay, so be calm and respect their boundaries. Should work for avoidance too. You're welcome, Jurassic. I've had trouble letting an ex go. What do you recommend? Okay, so that can be challenging, especially if there's BPD going on because of the attachment and the really intense emotions that are often associated with significant others. So what I generally tell people to focus on, if this is not someone who deserves to be in your life or someone you want back in your life, like this is over, it's done, they weren't good for you, or the two of you were like oil and water, or they were toxic or whatever, then I was just talking with a gal about this last week. I would focus on all the reasons that relationship is no longer, or that it didn't work, or that specifically it wasn't good for you. So this gal had a journal where she wrote about experiences with her ex. And what I had her do is, in hindsight, go back and look at those experiences and remind herself of why that relationship wasn't the best for her, wasn't the healthiest, didn't work, didn't respect her, those kinds of things. So Elizabeth, hope that helps. Differentiate between ASPD, antisocial personality disorder, and narcissistic. So the cardinal difference, there are a lot of nuances in that and a lot of overlap. But generally, the first thing that comes to mind is someone with antisocial personality disorder doesn't experience anxiety. A lot of times those people are budding psychopaths, and so there's a dysregulation in the brain, and they don't experience anxiety. There's not necessarily much of a conscience or conscientiousness, whereas people with narcissism, they, depending on where they are on the continuum, because that runs on a continuum too, they may look sociopathic or antisocial. There's a lot of overlap in that cluster sometimes, but they will experience anxiety about things. So hopefully that helps. Okay, Opal's scratching my legs up. Okay. You're doing great, Nikki. Don't sweat it. Don't sweat it. We just keep asking questions until we figure it out. Elizabeth, you're welcome. Pancake Mix, you're welcome. These handles just crack me up. I mean, mine's called Shrink Think, so, I love a fun handle. Okay. No, not interested, whatever that handle is. Seriously, guys, I'm a professional psychologist of over 20 years. Stop with the BS, okay? I'm not interested in your terrible comments and swingers clubs. Seriously. All right. I think I've gotten to all the questions. So thank you guys for tuning in. As I said, I was AWOL for a little while doing taxes. I'm going to be AWOL again, working on getting ready for a presentation. But I will be back when I can and answering questions and returning messages as best I can. So thank you guys for bearing with me. Okay, Justine, really quick, let's answer this. I have known for a while that I exhibit many signs of BPD, but I fear getting a diagnosis because whatever the reason that you fear getting a diagnosis, thank you guys for the gifts. I understand your fear, but help and feeling better and being healthier is on the other side of that. The accurate diagnosis is going to help inform the best, most accurate, most helpful treatment plan. So I know it can be scary, but go in, having done your research, take a look at what the criteria are. If you think you have BPD, go in, ask the provider to walk through those with you. If you feel like they're not understanding, you can reiterate, you can ask questions, you can highlight the symptoms you have that seem to fall within those criteria. Get that accurate diagnosis so you can get a good treatment plan. If you don't want to get a diagnosis, but you think that BPD is what's going on for you, go check out the resources tab on my website, the section for borderline personality disorder. Lots of self-help resources under there. You can get started with those. Some of them are, they're all pretty low cost. They're books and workbooks and things like that. So beyond that, you can do a search online for DBT, dialectical behavior therapy, and you will get a good jillion resources that are free and informative. Oh, you guys are welcome. You're welcome, cheap batteries. Absolutely, Justine. All right, you guys, I'm going to go eat some dinner, and I'll get on when I can. Like I said, busy with getting ready for a presentation. A couple of resources that I mentioned. If you want resources for BPD, go to the resources tab on drbellingrodt.com. And then the other resource I mentioned was my book on relationships, Fix Your Freaking Marriage. And it talks about 16 elements for marriage, forgiveness, dealing with challenging partners, all of those things. Do you think I got BPD due to an off and on toxic relationship or fear of abandonment? Elizabeth, I would need some context for that. Generally, we're looking at the development of BPD early in life. So whatever was going on early in life, if there was some abandonment trauma or things like that, then that's more what we're looking for. All right, you guys, have a good night, and I will hope to see you soon.